Hey everyone, welcome back to the channel. I'm Annie and today we continue our 3D exploration of the neurocranium. Let's take a deep dive into one of the most recognizable bones of the skull, the frontal bone. We will cover its description, parts, surfaces, key landmarks, articulations, sutures, and even its craniometric points. Let's go. The frontal bone is a single unpaired bone that forms the forehead, the roof of the orbits or the eye sockets, and part of the anterior cranial fossa. It's a flat bone and one of the first bones seen from the front view of the skull. Now let's talk about the articulation of the single frontal bone. Let's begin with ethmoid bone. Anterior view, left lateral view, posterior view, posterior superior view, let me do the inferior view, and right lateral view of the articulation of these two bones. Additionally, frontal bone is associated with the sphenoid bone. That's a posterior superior view. In between frontal and sphenoid, we have ethmoid bone. From the previous video, you must remember that frontal bone is associated and articulates with two parietal bones via the coronal suture, and here you have the neurocranial connection of the frontal bone. Additionally, frontal bone is associated with two lacrimal bones. This one is ethmoid bone. Here we have frontal and two lacrimal bones. Frontal bone is associated again with the two nasal bones. For better clarification, I want to fill some gaps for you. This is ethmoid bone next to the anterior lateral lacrimal bone on each side. And here we have also the nasal bones on each side. And if you observe between lacrimal and nasal bone on each side, right side as well as on the left side, there are gaps. And I want to fill those gaps for you and tell you what bone fills that space in the viscerocranium. Ethmoid, lacrimal, left nasal, left maxillary bone that fills all that large gap that was created on each side. So here you have the ethmoid bone, right lacrimal, right nasal, and right maxillary bone. And the last facial skeleton, or the bone that is associated with frontal bone, is zygomatic bone or cheekbones, we can also say that, which is very tough and thick. Now let's talk about the parts of the frontal bone. The frontal bone is traditionally divided into three parts. The one is the squamous part. Do you remember what was the squamous part? It's actually the flat part of something, in this case the frontal bone. And then we have this orbital part, which forms the roof of the orbits, and the nasal part, which articulates with the nasal bones and nasal cartilages. Okay, so three parts. Now let's talk about the surfaces. Obviously, because the frontal bone is a flat bone, it has external surface of the squamous part of frontal bone. So listen, now that's a very major distinguish for you to understand. As a part, it's a squamous flat part, but this flat part has two surfaces: external surface, obviously, which is outside, and the opposite to that, we have internal surface of the squamous part of frontal bone, which is in touch with meninges. Here you have the supraorbital margin. Now, the name is very much simple and quite logical. So orbit means the eye. So above the eye, there is a margin. on each side, the right side and on the left side. There is nasal margin of the frontal bone that is for the articulation with the bones of the nasal bones. Okay, let's turn around this way from internally. Let's look at that. So this surface called cerebral surface of frontal bone, with this margin is sphenoidal margin of the frontal bone. Why? Because through this margin, the shape it is, the triangular in shape, the frontal bone is attached or creates the suture, immovable joint with the sphenoid bone. All right, now let's move to the landmarks of the frontal bone. Actually, what landmarks is that surfaces or parts of the surface that is attached to something else. For example, the muscle or the tendon or the arteries or the blood vessels. That is for the landmarks. Let's start with the obvious. This one is called frontal eminence. Eminence means elevation. So if you look from inferiorly, you are going to see that on the frontal bone, there is a frontal eminence. Below to that, we have superciliary arch. Let's divide this word. Cilia means tiny hair. Around that area, tiny hair is eyebrows. So now let's turn this model, the frontal bone, and we are going to distinguish the other parts as well. Here is called the temporal line and the temporal fossa. Fossa is depression, right? And this line is for a muscle we call temporalis muscle, which helps us to chew or to close the lower jaw. And the temporal fossa is the depression for that muscle, so the muscle does not get protruded. Let's move to the other landmarks. If you look from the internal surface, you're going to observe groove for superior sagittal sinus. And here you have zygomatic process of frontal bone through which the frontal bone is attached or creates the suture with the zygomatic bone. That is nasal spine. Makes sense why we call this a nasal spine. Now let's look from the inferior view. We are going to distinguish the fossa for lacrimal gland. Easy breezy name, we understand. There is a supraorbital foramen, and the supraorbital foramen is for the supraorbital artery through which the artery passes. Here you have trochlear fovea. Let's go through the sutures, just name all the sutures. We know that here are two nasal bones attached, so we call that frontonasal suture. We know that here the ethmoid bone is attached, frontoethmoidal suture. We know that through this triangular shape, sphenoid bone is attached, so we call that sphenofrontal suture. We know that through this protrusion, the zygomatic bone is attached, so we call that frontozygomatic suture. And we know that through this edge, the parietal bones are attached to the frontal bone, and this suture is called coronal suture. In terms of the craniometric points, this is called glabella, this is called pterion, Stephanion, and bregma. Bregma is the point where the coronal and sagittal sutures intersect top of the head. Now, let's talk about the arterial supply to the frontal bone and the regions or the structures associated to the frontal bone. What I'm going to talk about is just the anterior or external blood supply, and later on we will talk about the intracranial blood supply. The first one and the first major that we can see the blood supply is supratrochlear artery. Do you remember we had the supratrochlear arch here? That is this artery is named after that landmark. We have that artery on both sides, right and left. let's say the origin, from where does this artery, supratrochlear artery, coming from? The first thing that, or the first branch that it is originating from is ophthalmic artery. Here you have that ophthalmic artery. This one is left ophthalmic artery, which is a branch of internal carotid artery, which is the branch of left common carotid artery, which is the part, or the, say, the branch of the aortic arch. Now let's talk about the right supratrochlear artery, which is again branch of the ophthalmic artery, which is the branch of internal carotid artery on both sides. And here you have the right common carotid artery again, but this one is branch of brachiocephalic trunk. The other artery, one of the major ones that supplied frontal bone and the associated structure, is called supraorbital artery. When we were talking about the landmarks of this bone, we talked about the supraorbital fossa through which this artery is passing through. Again, the supraorbital artery is a branch of ophthalmic artery, which is the branch of internal carotid artery, and common carotid arteries on each side. And that wraps up our detailed look at the frontal bone, its structure, surface, landmarks, and clinical significance. In the next video, we will dive into one of the most complex and fascinating bones of the skull, the sphenoid bone. Trust me, you don't want to miss it. It's beautiful, and it actually opens so many doors in terms of the understanding the skull and fossa and the openings the skull. If you found this video helpful, please like, subscribe, and hit the notification bell so you stay updated with every new anatomy lesson. And if you have any questions or need clarification on anything we covered, feel free to leave a comment below. I'm here to help. Thanks for watching, and I'll see you in the next one.